The next position we will talk about is kneeling. In kneeling, the patient is basically standing on their knees, and this is a relatively stable position. So compared to positions we will move to, this position has a large base of support and a relatively low center of mass compared to positions we were coming from, like supine or hook lying. In this position we have smaller base of support and higher center of mass. So basically we are gradually transitioning in positions. If we look at kneeling, we will see that the base of support is the whole area between the patient's legs. The center of mass is in the trunk, and the distance between center of mass and base of support is relatively small compared to, for example, standing. That's why this is a stable position for the patient, and the risk of falling is low because the distance to the floor is very close. So whenever the patient feels unstable, they could basically reach out to the floor without the risk of falling. If we look at the patient, the head should be in neutral, the trunk should be in normal curvature, the pelvis should be level on both sides, and there is equal weight bearing on the knees. If the patient is unstable, especially at the beginning, we might assist them by performing the exercises with the hands resting on the therapist's shoulder, and we could apply the different techniques. Or we could bring a ball and put it in front of the patient and have them rest their hands on the ball. If the patient has limitation in the ankle range of motion, we could place a small towel under the ankle to relieve the plantar flexion, or we could do it at the edge of a plinth so that the feet are hanging off the plinth. The last thing about the kneeling position is that it has less degrees of freedom compared to standing, and that's why it's an easier position for the patient, because basically they need to control the position of their head, trunk, pelvis, and to a very little extent the knee. Whereas compared to standing, in standing we need to control the knee in addition to the ankle. That's why here we have less degrees of freedom, and this makes kneeling a more stable and easier position for the patients. The major advantage that we might face with some patients is that we are bearing weight through the knees. So for patients who have knee pain, this might be an uncomfortable position, and that's why having the exercise on a soft surface could relieve the pain, and every now and then we could simply relax and have the patient sit on their heel on heel setting, and this will make it relieve the pressure from the knees.